Welcome to another podcast from Snazzy Surgeon. Today, we're embarking on a deep dive into, well, one of the most complex yet really elegantly designed structures in the human body, the hand. As reconstructive surgeons, our mastery of this area is fundamentally tied to a nuanced understanding of its anatomy and biomechanics.
Indeed. And, understanding the hand, it transcends just mere memorization of structures, doesn't it? It's really about appreciating a profound legacy of scientific inquiry, each discovery directly impacting our surgical practice. This deep dive isn't just a historical review, it's an exploration into how our collective understanding has evolved, emphasizing why a holistic, integrated view is, well, absolutely critical for any surgeon dedicated to hand and upper extremity reconstruction.
Exactly. Our mission today is to distill the key historical milestones, unravel the intricate interplay of the hand's various systems, and crucially, connect all of this back to tangible clinical pearls that profoundly aid our surgical decision-making. We're going to unpack why these foundations are so relevant to the complex cases you face every day.
It's quite a journey. For centuries, our grasp of the hand was quite literally a slow, evolving process. We've moved from some pretty rudimentary observations to an extraordinarily clear picture now, and tracing this evolution, I think, offers invaluable context for our modern techniques.
Absolutely. Where does it really start? Vesalius.
Yes, it truly began with figures like Andreas Vesalius back in the Renaissance. Before him, anatomical knowledge was largely based on, ancient texts and animal dissections, which led to significant inaccuracies. Vesalius, through meticulous human dissection documented in De Humani Corporis Fabrica, corrected many of these early misconceptions. He brought gross anatomy into proper focus.
So it wasn't just groundbreaking for its time, it set a standard.
Exactly. It established the empirical method that underpins all anatomical study, ensuring that our understanding of structures is based on direct observation, not just dogma. That foundational precision is still what we rely on, really, when we make our initial incisions.
Right. And this pursuit of precision then moved beyond just description, didn't it? I'm thinking of Sir Charles Bell.
Ah, yes. Sir Charles Bell in 1834. His seminal work, The Hand, Its Mechanism, and Vital Endowments as Evincing Design, was truly revolutionary. He didn't just catalog anatomical parts, he contextualized the hand within the broader animal kingdom, presented it as a marvel of unique design, perfectly adapted for human purpose.
That holistic perspective feels paramount today, especially when we think about reconstructive goals.
We're not just fixing parts, are we? We're restoring an integrated, purposeful tool. And this influences how we approach preoperative planning, aiming to recreate natural movements and function. It even guides our post-op rehab strategies.
That foundational thinking, blending structure with function, that continued profoundly with Guillaume Duchenne in 1867.
Yes, Duchenne. His classic volume, Physiologie des Mouvements, offered an unprecedented detailed analysis of muscular function. What made his work so impactful was his method. He achieved this through isolated electrical stimulation of individual muscles in living subjects.
Which must have been just groundbreaking at the time.
Absolutely groundbreaking. It allowed him to observe and document dynamic muscle action. It fundamentally shifted our focus from static anatomy to, well, dynamic function. Duchenne's insights help us even now predict functional deficits and guide our decisions on things like tendon transfers. We understand not just which muscle acts, but how it acts in concert with others.
And the understanding continued to deepen, extending beyond just the human hand.
That's right. Moving into the early 20th century, you see figures like Frederick Wood-Jones. His 1920 work, The Principles of Anatomy as Seen in the Hand, probed deeply into comparative anatomy and anthropology. This gave us a broader evolutionary perspective, highlighting the hand's remarkable adaptability and specialization across species.
Which for us offers a deeper appreciation for the unique evolutionary pressures that shape the human hand. It can inform our understanding of congenital anomalies or even variations in anatomy.
Precisely. Then came the more direct surgical applications, the ones that became cornerstones of our field. Alan B. Canavel's 1925 monograph, Infections of the Hand. It provided such a detailed analysis of the hand's complex fascial spaces and synovial sheaths. His work was absolutely crucial for effectively managing hand infections.
Guiding us to understand the spread of pus, the necessity of precise surgical drainage, that knowledge is still paramount in every emergency hand clinic today.
It really is. And this was quickly followed by Sterling Bunnell's Surgery of the Hand in 1944. Became an indispensable reference during World War II, showcasing its immediate practical value in trauma and reconstruction. Bunnell essentially codified many of the principles of hand surgery we still follow.
Speaking of profound practical value, Emanuel B. Kaplan's 1953 volume, Functional and Surgical Anatomy of the Hand. That set a new gold standard, didn't it?
Oh, absolutely. It offered beautifully illustrated and incredibly detailed insights that connected structure directly to function. It really provided a roadmap for any hand surgeon. Kaplan's work is a constant reminder that form and function are inseparable. His diagrams are still a benchmark for understanding complex relationships, particularly for planning intricate procedures like tendon repairs and nerve grafts.
So, building on these historical foundations, our modern understanding continued to deepen, especially regarding the complex interplay of muscles allowing for such precise movements.
That's right. Detailed studies on the integration of intrinsic and extrinsic muscles operating the polyarticular digits were significantly advanced by figures like Landsmeer, Kaplan again, Eiler and Markey, Stack and Tubiana and Valentin. Their collective work truly helped us appreciate the synchronized effort required for seemingly simple tasks, from grasping a delicate instrument to performing intricate surgical maneuvers ourselves.
Landsmeer, for example, his concept of the intrinsic plus and intrinsic minus hand. That gave us a framework, right?
It's exactly. A framework to understand how the balance between these muscle groups dictates function, and how imbalances contribute to deformities that we as surgeons must correct. Their research informs every tendon transfer, every assessment of hand deformity.
What's particularly fascinating about this continuous investigation is how it directly refines our surgical approaches. More recently, we've seen significant developments in new flaps.
New flaps, both intrinsic to the hand and derived from the upper extremity. And this stems from even more detailed investigations into vascular anatomy. The advent of perforator flaps, for instance, driven by advancements in vascular mapping, allows us to harvest thinner, more pliable tissue, often from the forearm itself.
Which minimizes donor site morbidity, say on the leg or groin, and often results in superior aesthetic and functional outcomes right there within the operative field, offers precise, custom-fit solutions for complex defects.
Exactly. And if we connect this to the bigger picture, similar detailed investigations have profoundly expanded our knowledge of the ligamentous anatomy of the wrist. Contributions from researchers like Berger and Viegas and his colleagues have been critical here.
Their work, delving into the intricacies of intercarpal ligaments and their biomechanical properties, that's dramatically improved our understanding of wrist stability, hasn't it? And the mechanisms of carpal instability.
It really has. It means we can diagnose and treat complex wrist injuries with far greater precision now. Allows for more stable repairs and hopefully more predictable long-term outcomes than ever before.
It's incredible to think of the hand as this sort of functional puppet, responding directly to our desires with such fine control. But what's actually going on behind the scenes, making those precise, often subconscious movements happen?
Well, it all starts centrally, doesn't it? The motor performance of the hand is initiated by the contralateral cerebral cortex. These conscious demands, our intentions to move, to grasp, to manipulate, are relayed from the central nervous controlling mechanism down to the hand and forearm as movement commands. It's a sophisticated top-down approach.
But it's not just a direct sort of monolithic command like a simple on-off switch, is it? There's a huge amount happening at a subconscious level to fine-tune that initial command, more like a complex orchestra conductor.
Precisely. At these subconscious levels, a movement command isn't just a simple instruction. It's meticulously broken down, regrouped, coordinated, and then sent as discrete signals for very specific actions. This could be the subtle fixation of a particular joint, providing a stable platform, or the graded contraction of a specific muscular unit for power, or even precisely timed relaxation for a smooth release.
So this intricate internal processing ensures both efficiency and accuracy, allowing for movements ranging from a powerful grip to, well, the delicate manipulation of a suture needle.
Exactly. And the body doesn't just send a command and hope for the best. What's truly remarkable is how the system continuously modifies these actions in real time. The degree of contraction or relaxation is adjusted constantly by continuous feedback, ensuring the motion created is precisely what's desired, whether you're doing a delicate microvascular anastomosis or just typing.
And those modifying factors, the ones essential for that remarkable precision and adaptability, they arrive centrally from a whole host of sensory sources.
A multiplicity of sources, yes. Think about the constant visual input from the eye, guiding a reach. The tactile feedback from peripheral sensory end organs in the skin, providing information on texture, pressure, and then the proprioceptive input from specialized muscle or joint sensory endings, reporting on joint position and muscle tension.
This constant loop of command and feedback, that's what gives the hand its incredible dexterity.
It is. And this raises an important question for us in reconstructive surgery. How much of this intricate central and peripheral control can we truly replicate or assist surgically, especially when dealing with severe nerve injuries, amputations, or complex neuroprosthetic interfaces? Our interventions must strive to restore not just movement, but meaningful, adaptable control.
Which means for any reconstructive surgeon working on the upper extremity, this intricate dance between anatomy and function isn't just academic, is it? It's absolutely paramount.
Completely paramount. You must be intimately aware not only of the complex anatomy of the hand and arm down to the smallest nerve and vessel, but also of the physiological interplay of balanced muscular functions, all under the precise influence of that complex central nervous coordination we just discussed. Failing to consider any of these elements can lead to suboptimal results, or worse.
Or even catastrophic failure of an otherwise technically perfect repair. So it's never just about repairing a damaged structure in isolation.
Never. It's fundamentally about understanding its dynamic role within the entire system and anticipating how it will interact to restore integrated function. Our focus must always be on the holistic restoration of purposeful movement.
And furthermore, the maintenance of physiological viability by the central and peripheral circulatory and lymphatic systems must also be a primary concern.
Absolutely. You can execute the most technically perfect tendon repair or nerve graft, for example, but if the local blood supply is compromised or venous drainage is inadequate or lymphatic flow is disrupted, that best technical repair can be completely compromised, leading to tissue loss, delayed healing, or functional deficits. A beautiful nerve graft won't regenerate if the surrounding vascularity is poor.
Which is why our attention to detail, from meticulous dissection to understanding flat physiology, is so critical.
Exactly. So we connect all of this to the bigger picture, what we've covered today. From the foundational historical insights into hand and upper extremity anatomy, the evolving clinical pearls gleaned from modern studies, new anatomic descriptions, and the core principles of neuromotor control. All of it serves to aid the hand surgeon in providing the best possible care. It's a continuous learning process, isn't it? Integrating all these facets, constantly striving for a deeper understanding that translates directly into better patient outcomes.
What an incredible deep dive into the hand. From, the groundbreaking anatomical work of Vesalius and the functional insights of Bellin Duchenne to the detailed studies of muscular, vascular, and ligamentous anatomy that inform our current reconstructive options, it's clear that our understanding is constantly evolving. It makes this field endlessly fascinating and challenging for every plastic surgeon.
Indeed. The hand truly represents a unique intersection of history, biomechanics, and neurological marvel. As reconstructive surgeons, our continuous learning about these intricate details directly translates to better outcomes for our patients, allowing us to restore not just form, but truly meaningful functional dexterity, which raises an important question for you to consider.
Okay.
As our understanding of microanatomy and neurological pathways continues to grow, and technologies like advanced neuroprosthetics and biointegrated interfaces mature, what new frontiers in hand reconstruction do you foresee becoming standard practice in the next decade? What innovations will fundamentally reshape how we restore lost function?
That is a truly thought-provoking idea to end on. We hope this deep dive has offered you valuable insights and perhaps sparked some new questions in your own practice. Thank you for listening to our podcast. See you in the next episode.